had a baby, and are you wondering how to manage any sort of scarring that you may have had as a result of your delivery? I can answer that question for you, and we're going to talk first about the perineal scar. So this is either from a tear that you had on your own or perhaps an episiotomy that was done in the hospital. And those incisions, if we're looking at the pelvis here, vaginal opening here, rectal opening here, those incisions are somewhere in the perineum for the most part. So once soft tissues have completely healed, usually takes 4 to 6 weeks, which is why it's nice to get the okay at your 6-week postpartum checkup. You can do a gentle scar massage perpendicular to the incision. You can also make tiny little circular motions to break up any cross fibers. And what we do in physical therapy that you could also try to replicate at home is to put one finger into the vaginal opening while you leave your thumb on the outside and kind of roll the tissue between your fingers to break up any sort of adhesions in the inside or the outside portion of the scar. Again, if you don't feel comfortable doing this yourself, get a script for a women's health physical therapist, as we can definitely help you with these scars. Now, if you've had a C-section, you have 2 incisions you need to think about. You have the external incision that you can see, but you also have a much deeper incision on the uterus where they made a tiny slice to retrieve the baby. Both of those scars need to be worked. The external scar you can do similarly to the perineal scar, where you're massaging and mobilizing it perpendicular to the scar, circular motions across the scar, and even plucking it where you lift the skin up and kind of rub it between your fingers. Again, only after soft tissues have completely and totally healed, as recommended by your provider. But when it comes to that deeper internal scar, that's really hard to get on your own. And I recommend seeing a therapist who's trained in visceral mobilization, or even someone who does a massage technique called Maya Abdominal Massage. Scars anywhere in your body need to be worked. They can form adhesions, limit your range of motion, and affect your activity performance. So we want those scars worked as soon as they're ready to be worked. My name is Carrie. I'm a women's health physical therapist, and I teach a 6-week postnatal Pilates class that's a combination of education and exercise, where I teach you all of these things that we're often not hearing from our prepared childbirth classes or our doctor's office visits or from our friends. And I also instruct you in expertly designed Pilates exercises to help you rehabilitate your body from the inside out. To learn more, visit my website at carriekoziel.com.